Hello, this is Dr. Nazare Magas coming to talk to you again. I've done quite a few videos now, and I don't know if it's 14 or 15, something like that. So if you happen to like this video or find that you learned something from it or you find it insightful or helpful in any way, I recommend that you go and check out the others because you might enjoy that too. And in addition to that, I really recommend that you send it to friends and family, people that you think might benefit from the information that I'm giving you here. If you find it helpful or insightful in any way, that way you can pass it on to other people and other people can benefit from this, which is actually my desire, that more and more people understand these aspects of human being and these aspects of psychology and these aspects about better relating. So today I actually asked a patient of mine if she had a question of something she wanted me to talk about a little more. And she did, and so I'm going to be talking more about psychic equivalence. Before that, I want to continue and close up my last video where I was talking about different types of psychologists, psychotherapists. And so I'm going to talk about that a little bit to kind of add to my last video so that you get an idea that there are different kinds of psychologists in how they treat you and how they view you. And their aim. What is their aim when they're seeing you? So in last video, I was telling you that I am a kind of psychologist that is in fact not very common. And that the reason that it's not very common is because I actually am very motivated to illuminate in the person I'm seeing. In other words, to make a person conscious and aware of some aspects of themselves that are typically patterns, ways of behaving, ways of talking, ways of relating to other people that are not constructive, that are not good manner. And I try to tell my patients about these patterns that I see so that they can begin to look at it, and usually because they're not positive ways, the person tends to not want to be that way. They want to change that. And that the problem with most psychologists is that most psychologists don't actually confront, meaning present to the patient, the things that they're noticing that are problematic, because people have a little difficulty hearing it. They have difficulty because it's not something flattering, it's not something positive, it's something problematic. Now, I want you to know something that you already probably do know, which is that people notice these patterns in us, I mean, right away. You know, within 2 or 3 visits, perhaps in the first visit, they notice something about us that's a little off or a little odd or a little unpleasant. But most people across the board do not tell you about these things. Unfortunately, most people keep that to themselves, or worst case scenario, they tell other people about it. That's the gossip, and they're talking about some problem of yours. But to me, that is so sad, because the person who needs to hear it is the person who has this pattern, who has this particular problem. But I want you to know that friends don't typically tell you, because they want to preserve equanimity, you know, the flow of the relationship. They need your friendship, so they want things to go well. And if they tell you these things, you probably don't like it. So people avoid telling people things they don't like. Really good friends, if they're really loving, they might tell you kindly. But again, most commonly, very close friends don't tell you either, because they have even more invested in the relationship. So they don't want to upset you. But I want you to know that everybody sees it. So everybody knows about it. And the one missing that information is you. And I think that's awful. Because if it's me, I really want to hear what I'm doing or what I'm saying, or what is a typical way that I do something that is problematic and causing people discomfort or distress. Because I usually would like to change that. But I can't change something I'm not aware of. So I was emphasizing that I am the kind of psychologist that will actually kindly and lovingly, not with a bat to hit you over the head, but kindly and lovingly make you aware of these patterns that are problematic and that are negative, that are destructive. But I also want you to know, by contrast, that most psychotherapists, psychologists, social workers, psychoanalysts, they typically also omit telling you. And they do something that a psychiatrist in London came up with a name that I'm going to give to you, very clever, And he called the kind of psychology treatment that most psychologists offer, he called it tea and sympathy. He's British, so of course tea is part of it. But he called it tea and sympathy. Essentially what that is, what he was referring to, is that psychologists are talking to you, hearing your problems, listening to your stories, and they're mostly validating. What is validating? They're agreeing with you. They're seeing things from your point of view. And they are telling you that they can see your perspective, they can understand your thinking, they can understand why you came to do whatever you did. That's all wonderful, except that if what you're doing is destructive, if what you're doing is missing information about other people or about other people's ways of being, then being validated, being agreed with, while it feels good, you don't grow. You don't learn anything. So tea and sympathy is this clever psychiatrist came up with that term because it offers tea, like something comforting, and sympathy, like I validate you, I see your point of view. So because many of you may go out and have therapy or are having therapy today, I really want you to keep in mind these two differences. And you can seek out people that are more likely to be more able to deal with your discomfort, to deal with you maybe not liking something. These are people that are stronger. They are not so disturbed by somebody being upset with them or angry with them. But you want to be with a person who is able to tell you things about you that you are not aware of, but are not positive, they're not helpful, and they can even be destructive. So that is the tail end of my last video, and I will talk about it more as people ask questions. But now I'm going to talk about psychic equivalence, which is, by the way, when a person is in psychic equivalence, then they are in a place where they definitely need somebody to tell them that their thinking is not right, that their thought processes is incorrect. So you would need somebody who actually helps you see that. So what is psychic equivalence? Psychic equivalence is a term that was coined by in Britain by the mentalizing-based treatment clinics in England, and they are people who are developed and are trained in what's called mentalizing-based treatment. And that is something that I studied in London at the Anna Freud Center. But it is now in the United States too, and it's a wonderful way to understand human minds and to become broader in your understanding of other people as well as yourself. In psychic equivalence, a term that comes from this kind of treatment, mentalized-based treatment, is one of the states of mind where there's an error in thinking. So this is what happens. What happens is that you're with somebody and they're telling you something, or you're not with somebody and you get a call or you don't get a call, and you assign meaning to that behavior or to that sentence. Your mind gives it a meaning. And for example, I had a friend recently whose husband wrote me that he had written to me and he had written to my husband, and that we had not responded, and that he felt bad about that, and he felt like he was trying to be close, but it wasn't happening. So when he told me that, I told him, actually, I always respond to you, pretty much, unless I'm in Spain and I don't have service. I explained that to him. But my husband doesn't respond to texts very much at all because he doesn't even see them. So I explained to him that indeed, for my husband to not respond is very easy, and that it wouldn't be because he's rejecting him, not liking him, not wanting intimacy. So this particular person, one of my friend's husband, was interpreting the lack of response from my husband as a lack of interest, a lack of wanting to connect, and somehow it could even be not being liked, right? So if the person thinks it's because he doesn't like me, it's because he doesn't want to get close to me, it's because he thinks poorly of me, any of these three sentences that I just offered you, they're all interpretations. So the fact is that my husband didn't answer. That is, everybody can agree on that. Everybody can look at his phone and see, oh yeah, he didn't answer. That's a fact. A fact is something that everybody can agree on, pretty much everybody. If the person is a little cuckoo or they're on drugs, maybe not. But in general conditions, we can all agree that today, for example, in my house it's sunny, and we wouldn't have any problem other people recognizing that it's sunny. or the door to my office is closed right now. And if I had other people here, everybody would agree that the door is closed. That's a fact. What's interpretation is if, for example, somebody comes to my office now and the door is locked, and they now think that the door is locked because I don't want to see them. That's an interpretation. So interpretation is what the meaning we give to an action or a lack of action. Like in the case of my friend's husband, with my husband, he had assigned meaning to my husband not responding. So that would be a lack of action, right? So this event, the event whereby we interpret people's behaviors and comments, and we don't realize that we're interpreting. We actually make it's considered a thought problem, because you don't realize that it's a thought of yours, it's a thought from your mind, it's a creation of your mind, and you mistake it for a fact. So for example, the example I was giving you with my friend's husband, he could, if he hadn't talked to me, he could go on for a month, 2 months, or a year or 2 years thinking, this guy doesn't want to talk to me, he doesn't like me, forever. Because he's confusing his thought with a fact. So, and by the way, when this happens, when we misinterpret, it's a misinterpretation, because you think it's true for sure, that's the problem. With psychic equivalence, the interpretation that you make, you actually are certain that it's true. That is psychic equivalence. If you are not certain, if you say, I think, and really mean it, I think, or I was wondering, or, you know, it occurred to me, and really they're thinking, then they're not in psychic equivalence, because then you say, no, actually, really what it is that he doesn't really look at his texts. And then he would say, oh, okay, that makes sense. But if a person is in psychic equivalence, what's different about that state is that when you tell them, actually, no, it's not because he doesn't like you, it's because he doesn't look at text, the person would insist that he knows that it's because he doesn't like him. And you cannot dissuade them. If you insist telling them, no, really, that's not true, there's another reason, the person who's in this state gets more agitated. They actually get upset if you say that whatever they're thinking is a misinterpretation. So this is what psychic equivalence is. It's a thought problem. It's an error in thinking, whereby the person doesn't recognize that whatever is in their mind is a thought, and a thought is a creation of our mind, and confuses it with the fact the door is locked, the sun is shining. The why this is what is the interpretation. So in the case of my friend's husband, if the why is he doesn't want to be close to me, he doesn't like me, that's the interpretation. The lack of response, that's a fact. So I want you to try that on yourself, and how you're going to know that you're in this state of mind. And by the way, we all end up in this state of mind at times. So every one of us can be here at times. But the difference between human beings in this regard is that some people fall into this state of mind frequently. So it's characteristic, it happens a lot. And typically those people also take a long time to get out. So it would be very difficult to let them know that their interpretation is actually not correct, because they hang on to it tightly. But other people don't visit this state of mind very commonly. And when it happens, it's easier for them to adjust their mind and say, oh, I see how this could be the reason for this. So in psychic equivalence, you're certain, and you're going to notice, I hope you can try that on yourself, when you're really certain about something, to ask yourself, am I confusing a thought with a fact? And the other thing is, can you come up with a couple more interpretations? These are interpretations. So can you come up with, okay, maybe he didn't write because he doesn't like me, but also maybe he didn't write because his phone is broken. That's a different interpretation. As you can see, one is negative and one is benign. So I want you to notice this for yourself, and to notice when other people are in this place. And one of the ways you're going to know is the person is certain. They're treating it like a fact and it's certain. And the other way you're going to know is that if you disagree with them in any way, they actually get agitated. They get upset. And nobody gets in that place unless they're in this psychic equivalence. So there you have it. You can ask questions about it. It's a very helpful concept. And by the way, when people are in psychic equivalence, it's freaking hell relationally. Because it's called psychic equivalence because it's close to psychosis. It's called like a temporary psychosis because you believe something that's in error. So there you go. please feel free to ask questions or bring me examples, because I'll be happy to discuss this further, because knowing this has been incredibly helpful to me. I've known it for many years now, but it's been very helpful to my patients too. So I hope you enjoyed this. I hope you found something of use to you, and I hope that you can pass it on to other people, again, if you found it helpful. Bye.